So as strange as this may be, if we are going to focus on the limbs, we also need to actually focus on the feet. So we'll begin with a brief exercise to open up the underside of the foot. So we will focus on what's called the spiral line. And the spiral line actually has a stirrup-like line of tension that goes underneath the foot and then revolves around the body. So what I'm going to do is take a block. If you don't have a block, it's totally fine. If you have a stair, something that you can put your foot up on, that'll be ideal. So I'm going to take my foot to the edge of the block. I'm going to bend my left knee just slightly and bend my right knee, and I'm just going to shift forward and shift back. So this is all I'm doing to open up the bottom side of my foot and to create a little bit of opening in that line of tension, which is again called the spiral line. So this is it. Super easy. It actually feels pretty therapeutic. So from here, what I'm going to do is slide my foot down the block. If you can place the block against the wall, that would be ideal. So now I have my toes pointed up towards the ceiling. Same thing, I'm just going to bend my left knee and shift forward and shift back to create a little bit of space on the underside of the foot. That's it. Really easy. When you've finished with one side, you can just stand and pause for one moment and feel how soft and flat the foot you treated is compared to the one you didn't. So the next shape I'm going to take is I'm going to come onto my knees if that's comfortable for you. I'll extend one leg out to the side, so I place the sole of my foot, of the extended leg, on the floor. I will reach my right hand down my right leg and use the inhale and reach my left arm overhead. So I actually, rather than holding the position, so if you remember we talked about elasticity and plasticity, if I hold and reach, that's going to go towards the plastic end of things. What I want is something more elastic, so I'm going to take a dynamic movement. Inhale, I reach my left arm overhead. Exhale, I reach my left arm down my left leg. Inhale, reach. Exhale, lower. So you can pause maybe for one moment at the top and come right back down. So what I'm working is the side of my body. I will open up through my obliques and my intercostals, so the little muscles between the rib cage. That's essentially an area that's also impacted by the various treatments that you've undergone. So as I reach my left arm overhead, I can also play with what's called an internal and external rotation of the arm. Internal rotation is the arm rotating inwards. External rotation would be the opposite. So if I reach my arm overhead and rotate my left palm up towards the sky, I am internally rotating. If I reach my palm down, I externally rotate. So it almost seems as though it's switched, but this is external, this is internal. So if I inhale and reach my left arm overhead and internally rotate, I will feel more of a tuning and a pulling of this lateral line. You'll feel it from the hip all the way up into the armpit and underneath the arm. Another option would be to internally rotate, take your other hand, reach for your wrist, and use the inhale to just give yourself a little assist, and then lower. We can add on to that movement by bending the straight leg, rotating the toes to face the edge of the mat. I inhale, I bend my left or right knee, and exhale and reach with my left hand. So I bend and I reach. Bend, reach. Exhale as I lower, inhale as I come back up. Third motion of this shape, I can take the back of my right palm to the inner right knee. I close my left hand to my right. I inhale, open. So I open up through the left side body, deltoids, pec minor, pec major, biceps. Inhale. And at the same time, I'm gently pressing back on my right knee. Inhale, open. Exhale, close. Inhale, open. Exhale, close. And then I would switch sides.
So a number of the treatments we have undergone involve the limb, involve the pectoralis major and minor muscles, deltoids, biceps. Your whole limb might be affected. So typically what we like to do is bring movement, as much movement as possible to the limb by way of external rotation and internal rotation. But as I mentioned before, it's not as though you move one part of the body and nothing else moves. So what we want to try to do is move as much of the body as possible, but also add some targeted movement. So if I take a typical tabletop position, I plant my left hand and I use the inhalation to reach the right arm to the sky. As I exhale, I thread my right arm behind my left, I bend my left elbow, and press the knife edge of my right hand into the floor, rotating my right thumb up towards the ceiling. I bend my right arm and try to press my right hand towards my left hip. So I'm working on internal rotation with my right arm with a bent right arm. Pretty challenging. Press into the left hand, use the inhalation, reach the right arm to the sky. And then exhale, I thread all the way through, press the knife edge of the right hand into the floor. I bend my right elbow and I press my right hand to my left hip. Inhale, reach, open and extend. Press into the left palm, reach the right arm to the sky. Exhale, thread all the way through, press the knife edge of the right hand to the floor. Bend the right elbow, press the right hand to the left hip. Inhale, reach and extend. Exhale, bring the right hand to the floor and switch sides. So another movement we can work on with internal and external rotation of the arm with a twist of the torso would be a forward fold, a wide-legged forward fold. So I'm going to take my right hand and place it right underneath my right shoulder. Keep my feet wide, maybe rotate my heels out and my toes in just a little. I'll use my inhalation, bend my left elbow, try to reach my left elbow to the sky as I pull my right hand to the right side of the mat. Inhale, I lower. Pause for the exhalation, and inhale, I come back up. So all I'm doing here is trying to reach my left elbow towards the sky, press into my right hand, and try to pull my right hand to the right side of the mat. So this is simply going to give me some twist, some rotation, some length, and some activation of not only my rhomboids on my right side and my left, but maybe a little bit of the serratus anterior as I press into my right hand. So I add on to this movement. As I inhale, I reach my left elbow to the sky, pause for the exhalation, and on the next inhale, reach the left arm all the way up. I can play with that internal and external rotation as I maintain the twist. So I rotate my left arm, my left palm forward, maybe my left arm back. I bend my left elbow and I come straight back down to center. Then I switch sides. The next movement will continue to work internal and external rotation. So if I take my arms out at an angle and create cactus arms, or what we sometimes call goalpost arms, I bring my elbows the height of my shoulders. As I exhale, I try to keep my right elbow the height of my right shoulder as I rotate my right hand towards the floor. Inhale, come back to center. Exhale, bring the left hand towards the floor. So if I feel the back of my shoulder lifting up off the mat, then I know I've met my range. So I can definitely get my right hand to the floor, but if the back of my right shoulder is lifting off the mat, I'm essentially losing that targeted rotation. So I try to keep the shoulder head on the floor, and then I rotate inwards. So this is internal rotation with a bent right arm. The moment my shoulder leaves the mat, I know I've met my range. So maybe I just stay here. Inhale, lower, and then exhale, close. Same on the opposite side. So you can take both hands at once. If you feel you want to alternate, you can alternate. You're just aiming to keep the elbows the height of the shoulders, and you're aiming to keep the shoulder heads on the back of the mat, or you're aiming to keep your shoulder heads on the mat. We can continue to add on to various movements from the floor. It's a nice place to be. So as I inhale, I open my arms wide. I rotate my palms up towards the ceiling. all I'm gonna do here is make what one might call a snow angel. I'm just opening my arms, reaching my arms overhead, and then closing my hands back towards my hips. So what I'm enabling here is an external rotation. I rotate my palms up towards the ceiling. I open my arms. I try to keep the backs of my palms to the floor. As I reach my arms overhead, I might notice it's a challenge to keep the backs of the palms to the mat. If they need to lift, feel free to allow them to lift. Modify as you need. I exhale, I lower, I inhale, and I lift. Really nice, very therapeutic, especially if you have a lot of tension through the internal side of the arm. So when I externally rotate, I'm creating a little bit of a twist, and when I reach my arm overhead, I'm still trying to enable that external rotation. So this next exercise is continuing to work the internal and external rotation through the arms, but in a prone position. So I come onto the belly and I reach my arms out to the sides. And then as I exhale, I bring my hands so that they come to the lower part of my back, my lumbar spine. I can stack my palms, I can place one cheek on the mat, whatever works best for you, or you can keep your chin on the floor. I kind of like bringing one cheek to the mat. I press the top palm against the bottom palm and I try to lift my hands off my lumbar spine. This is the only movement I'm working on. I inhale, I lower, I let my elbows fall towards the floor. I exhale, I lift everything up. So again, very minor movements, but not easy by any means. Despite the fact that they are challenging, they definitely do help. They're very therapeutic for the body. Exhale, lift, inhale, lower. Very subtle movement. We're working on what we see as internal rotation. I stack my palms, I lift my hands off my back, and I lower. Once I've had enough of this movement, then I can add on. I lift my hands off my back, I straighten out through my arms, and I reach my arms overhead, bringing my palms to face the floor. I can pause here if I feel fatigued, and then when I'm ready, I lift my hands off the mat, I return to that same position, changing the dominant hand that was on top the first time. So if my right hand is on top the first time, I'll switch the stack. Lift my hands off the back, inhale, reach my arms overhead, rotate my palms to face the floor. I can place my palms on the mat to just pause for one moment if I feel fatigued. When I'm ready, I inhale, I lift. I stack my palms over my lumbar spine, and I allow my hands to come back to the back. Inhale, lift. Reach the arms overhead. Go for internal rotation. Plant the palms on the floor. Inhale, lift again. Open the arms wide. I restack. So all I do is work internal, external rotation as I create now a prone snow angel, a little bit more challenging than the one on the back, the supine version. All I do is stack the hands at the lumbar spine, switch the stack, inhale, reach, exhale, close. So same as before, what I'm working here is internal, external rotation through the arms. This might be a move that's quite familiar to you. You might have tried it before. We simply stand with the feet about hips width distance apart. As I inhale, I reach my arms overhead. I take my right hand and reach for my left wrist. I use the inhalation to take a gentle bend towards the right. If it feels okay, I can bring my hips a little bit more to the left and keep reaching with my right arm. Same as before, I can rotate my left palm up towards the ceiling and take that side bend. I inhale, I come back to center, and I switch sides. So a gentle reach with the right arm overhead. I rotate my right palm up towards the ceiling. So again, I go for internal rotation. I add a gentle tug with my left hand to my right wrist, and maybe I bring my hips a little bit over to the right. I could look underneath my right shoulder if that works. And I inhale and I come back to center. Essentially what I'm working again is the side body, the lateral line, a little bit of the serratus, and as I internally rotate, I add some extra mobility through the shoulder. So I inhale, come back to center, and I switch. The bend does not have to be deep. You just go at your range and whatever feels best for you. This next move, I'm going to bring my feet a little bit wider than my hips. So it's a typical warrior two stance with the legs. I'll rotate my right toes forward to the top end of the mat, and my left foot is going to be rotated at the same angle as my left knee. I'll reach my hands out, right and left, so it's basic warrior two, something we've all seen on all those yoga calendars in different places. But what we're going to do is we'll add a twist. Rather than simply reaching through the arms, I'll flex out through my palms, and I'll reach my left hand forward and my right arm overhead. I'll windmill my hands, and I'll reach my right arm back and my left arm overhead. So all I do is create a gentle windmill motion of the arms. I maintain the warrior two shape of the legs, and I press out through the palms, so I'm engaging through the entire arm line, deep front, back, superficial front, and superficial back. If it's too challenging to maintain the warrior two legs, you can take this in a basic standing position. Just reach the arms overhead, one forward, one back, maintaining the flexed palms and the fingertips reaching up towards the sky. Inhale to windmill open, exhale to take the rotation. So as I mentioned before, we work different arm lines, of which there are 4 primarily, but 2 essentially from front and back, or deep front, deep back. Those arm lines land in 2 muscles of the palm. The big muscle on the thumb side is called the thenar muscle, and the small muscle on the pinky side is the hypothenar. So this is where the deep arm lines, or the arm lines, end. So if I press my pinky and my thumb together, I'm actually activating both lines throughout the arm. So I can do that on both sides. I can either stay in this standing position, do the same thing as before. I press all of my other 3 fingers together, and I press one arm overhead, and I switch and switch. If I want, I can take that warrior two shape again just to add a little bit more, only if it works for me. I press one arm overhead, one arm forward, I switch. All the while pressing the pinky and the thumb together. So what I'm doing again is I'm activating the arm lines, which end in these 2 muscles of the palm. The next move, I can bring my feet about hips width distance apart. I use the inhale to reach my arms forward and bend my elbows. I make little fists, so a couple of options here. You can take the fist with the thumb on the outside. I actually like the thumb on the outside, on the inside, so there's a nerve that runs right through the wrist. If the thumb is on the inside, you might feel a little bit more of a fluid movement. All I'm going to do is keep my elbows the height of my shoulders, and I'm going to bend my wrists and try to bring my palms towards my forearms. Then I take a little rotation. I rotate my hands towards my face, and I continue this pulse down towards my forearms. So I can come forward, and I can rotate back. Once I've completed a number of these, maybe 4 or 5 rounds, I open my elbows wide, and I continue rotating my palms to face in and my palms to face out. I do a few rounds of these, and then I simply take those cactus arms, not unlike one of the exercises we did before on the back. Now we simply take it upright, noticing when I bring my hand down, my shoulder wants to come forward. I bring my shoulder back and maybe shorten the reins just a little bit. So again, we're simply working internal and external rotation with a little bend at the wrist to work the flexors and the extensors and the fascia that envelops all of those. This next exercise is a little bit more dynamic in nature with a slight bounce. So what I'm going to do is take my feet a little bit wider than hips width. I'll bring my arms out to that goalpost shape, trying to keep my elbows the height of my shoulders. As I rotate my torso to the right, I'll reach my right leg across the body, flex out through my right foot, and rotate my right heel in and my right toes out. I come back to center. Exhale, twist, come back to center. So all I'm doing is trying to keep my elbows the height of my shoulders. I kick my right leg to the left, and I rotate my chest to the right. So you'll notice if I go a little bit quicker, I might create a slight bounce. So what I'm trying to do here is engage through the side body, rotate a little bit more, reach my chest to the right, my leg to the left. So I'm going to get my spiral line and the lateral line. I'm going to reach from that outer right leg all the way up and across the back, from the back of my right hip to the back of my left shoulder, and then across from my left shoulder to my right hip. So I'm getting that sort of matrix or loop that goes around the body. So this next exercise, I'm going to keep my feet about hips width distance apart. I'll reach my arms overhead, but before I do, I'm going to stack my left hand on top of my right. So as I reach my arms overhead, I press my left hand against my right hand. I'm creating a sense of pressure between my palms. The back of my right palm against the top or the front of my left palm. I inhale, reach my arms overhead, and I can hold this shape, just creating a bit of tension, pressing one hand against the other. Or if I want a little bit more, I create a slight bounce with my arms. So as I bounce my arms back, I keep pressing with my left hand and keep the resistance with my right. So I might take about 10 to 15, and then I inhale lower, because that's actually quite challenging. And then I switch sides. I stack my right hand on top of my left, so the palm is down, left palm is down. I inhale, I reach my arms overhead, and I continue bouncing the arms back. So as I bounce my arms back, I do want to allow my chest to come forward, and I can even allow my butt to go back just a tiny bit. So I create a little bounce through the whole system, and I lengthen through the tops of the arms, the front of the arms, and create a little bit of activation through the front of the body. In some cases, it might be quite a challenge to lift the arm overhead due to tension, due to pain, nerve damage, whatever the case might be. So if you are having difficulty actually reaching your arm overhead, you can take a broomstick, any type of stick, and rather than lifting the arm, keep the arm in one place and move the body around the arm. So I can take a kneeling position, I lower and I lift. This will enable me to lift my arm overhead and get some range, some mobility through my shoulder without actually actively lifting my arm overhead. So again, if it's too difficult to lift the arm, you want to make sure you maintain that range of motion, and you can do that by way of moving the body around the arm. Same goes, I can open, I can close, inhale, open, exhale, close. So you can play around with any type of stick, broomstick, you name it. You can lower, lift. We're trying to maintain some mobility through the shoulder capsule. So we want to continue to work the rotation through the shoulder. You can keep a stick if you've got one. If you have a resistance band, that also works. If your shoulders are pretty open, you can keep your hands close together. If it's challenging to create a rotation or to generate a rotation, you can bring your hands a little bit wider. As I inhale, I want to reach my arms overhead. And as I exhale, I lower my hands. So again, you choose which range, how close you want to bring your hands together, or how far apart you want to keep them. So I inhale, I reach my arms overhead. I exhale, I close. If I like, I bring my hands a little bit closer together. If this is working for me or for you and you feel quite open, you start to feel as though your range of motion is increasing, you can start to bring your arms a little bit more overhead and maybe behind your back. So you want to take this pretty slow. Maybe you go all the way down and come all the way back up. So if that works for you and you feel as though you're creating more range, you don't feel any pain whatsoever, you can walk your hands a little bit closer together. On the next inhale, I reach my arms overhead. I find the space where there's maybe a little bit more tension than usual. So here I don't feel as much tension, here maybe not so much, but once I start to find this space where there's extra tension, I gently draw my chin towards my chest and I just breathe here. Inhale, I come back up, and exhale, I close. You can do the same thing with a resistance band, or you can just take a basic stick. So with the various treatments you've undergone, surely the muscles of the rotator cuff have been impacted. So the rotator cuff includes 4 muscles. It's the subscapularis, the supraspinatus, infraspinatus, and teres minor. So what I'm going to try to do here is I can take a resistance band. You can even use a sock, whatever works best for you. I keep my hands the width of my shoulders and the width of my elbows. I reach my arms forward. I bend my elbows, and I'll notice right away that with the resistance band, my wrists want to come together, my elbows want to go wide. What I really want to work on is external rotation, so I keep my wrists the width of my shoulders. I inhale, I reach up, and I exhale, I come down. So I'm maintaining tension on the band as I inhale and I lift. I exhale, I lower. The same thing can be done without a resistance band against the wall. Pressing the pinky side of the hand into the wall and reaching the arms up and gliding them right back down. So this next position is actually a reclined twist. If I take a standing position and I draw one knee into the chest, I can bring my left hand to the outer right knee and open my right arm wide. Sometimes this is a difficult shape to maintain or to get into, so we can do the same thing on the back. I'll come all the way onto the back. I'll draw my knees into my chest just to allow for a little opening through my back. I can extend my left leg forward and maybe I pause here. If I feel good, I bring my left hand to the outer right knee and I reach my right arm out from my right shoulder. I inhale, and as I exhale, I take a gentle twist. So it's a pretty common reclined twist. If my right knee is far from the floor, I can always place a block or a pillow, some sort of support underneath my right knee. So what I'm trying to aim for is a rotation through the upper half of the body and an opening through the right shoulder. If, in order to get that opening, I need to press a little bit on my right knee, maybe that will work. It all depends on what's best for you. You can also play with, again, the internal and external rotation of one arm, so I can rotate my right palm to face the sky. I can inhale, reach my right arm overhead, and then exhale, bring my right hand straight back from my right shoulder. I can play with internal rotation. I rotate my right palm to the floor. I inhale and I reach my right arm a little bit higher. But you'll notice when I'm internally rotated, my right arm won't go as high. So maybe I rotate my right palm up to the sky. I open and I close. And then I rotate my right palm down. I open. My range of motion is not as wide. That's totally normal. And then I close. Exhale, I draw my right knee into my chest, pull my left knee into my chest, and then switch sides. Another exercise we can try is a typical tabletop. So if I come to a tabletop position, bringing my shoulders above my wrists and my hips above my knees, most of us have tried a cat-cow. So as I exhale, I round out through my spine, pressing the back of the heart towards the ceiling. And as I inhale, I lower my belly and I lift my chest. So this is a typical way we go through a cat-cow shape. What we can do is add on a little bit so we get a full activation through the front and the back of the body, and we get the shoulders to really work through this position. So as I inhale and I lower my belly and I lift my chest, I try to pull my hands and my knees towards one another. So at the same time I'm trying to open up through the front body, I try to engage through my front body and pull my hands back towards my knees, thus engaging through my shoulders. When I take the cat shape and I press the back of the heart up towards the ceiling, what I'm doing is I'm engaging my serratus anterior, which pulls my shoulder blades around the side body and widens through my back. So as I inhale, I lower my belly, I lift my chest, I pull my hands and my knees towards one another. As I exhale, I round out through my spine, I press the floor away, engaging the serratus anterior. I press my hands and my knees away from one another. So I simply add a little bit more activation as I go through these two shapes, cat and cow, pressing the hands away from one another as I take the cat shape, pulling the hands and knees towards one another as I take the cow shape. So again, I engage through my shoulders, particularly along the side body when I press the floor away and I take that cow-like or the cat-like shape. So this could be my typical cat-cow shape. Then when I've done maybe 4 or 5 rounds, I can walk my hands forward, keeping my knees directly underneath my hips. Bring my palms to the mat. If I feel good here, I rotate my thumbs to face up and I press the pinky side of my hand into the floor. What I'm doing now is engaging and lengthening through the back arm line. And it's the same shape that we took earlier with the resistance bands when you're reaching forward, up, and down. So now we're just using the floor as an area to press down into to create some tension through the arm lines and the side body. So all of the exercises that we've been working on include internal and external rotation through the arm. So what we're aiming for is increased mobility through the shoulder capsule. I internally rotate, I externally rotate. If I really want to open up through the front body, I might take an interlace of my hands behind my back, press my palms together, and open up through the chest. A lot of times that's going to be really challenging to do, especially if there's increased tightness through the pectoralis or the chest area and the arms. So another option would be to find a corner at home, most of us have them, and I will place my hands on the wall. I'll step my left foot forward. I bring my hands about the height of my elbows or my shoulders, and I press forward, and then I press back. So maybe I inhale to come forward, open up through the chest, and I exhale to press away. I may take 3 or 4 rounds, whatever feels best for you. You can always pause at one end range and come back. Whatever works best. So another option to continue to open up through the shoulder would be to bring the hand to the height of the shoulder against the wall. So it's again not unlike the exercise we did with the stick. If I open up my chest towards the middle of the room, I'm going to open up through the right shoulder and I can close again. Inhale, open, exhale, close. If I feel as though I'm creating a lot of range of motion and I feel as though I have a lot more space to go, I can rotate my fingertips to face the floor and I can continue. Inhale, open, exhale, close. So with the hand rotated or the fingertips rotated towards the floor, this is going to bring me to external rotation. Fingertips facing the ceiling, I'm working towards internal. So I can just alternate between internal rotation, fingertips facing the sky, external rotation, fingertips facing the floor. I simply open my chest towards the middle of the room and I close my chest towards my arm.